Okay. Thank you so much for joining in, guys. People who have just recently joined, thank you so much for joining in. Today's discussion or the lesson would be completely on OET Listening Part B. Now, we will be discussing over here things about like what can you do when you would be doing Part B, how you should prepare yourself. They give you 15 seconds before each audio has been played. So how can you utilize that 15 minutes? Which all things we need to keep in our mind. The way we have done the reading Part B lessons yesterday, the same way we are going to do it, but we have moved the lesson to YouTube. So people who are from Facebook have joined in the same way. You can comment in the chat box. I can see right now the joined people are Leslie, Victoria, Neetu. These people are there joining. So if you are participating, I'll be doing live listening audios of Part B. I'll also be guiding what to be done, how to identify these answers. What are the best technique which you can do when you are doing listening Part B? So you can participate. I'll be doing live test. So we can later discuss answers once the audio has been played. I'll be playing audio from my side. So if you have a pen and paper, please keep it ready so that you can write answers. You can write notes when this particular test has been discussed. Now let's begin with the listening Part B. You can see 5 people have joined. You can message in the live chat box. Don't mention in the comment. There is an option called as live chat. You can record it in the live chat. All your answers or anything you want to ask me, any questions, you can assess that over there. You can put it over there. Now, let's understand this very clear, how this listening ability is being assessed in OET. Let's understand this. What happens in listening OET? This is something what we need to understand the first point. Now, the listening subtest is designed to assess a range of listening skills, such as identifying specific information. Are you able to identify a specific piece of information in listening? This is something they're going to find out from your part A. Then the details, just opinion or the speaker's purpose, which is mostly seen in B and C. These skills are assessed through note completion task and multiple choice questions. So as I told you, note completion tasks are mostly in part A. Multiple choice questions will be in part B and C. Now, the assessors who will be marking your listening subtest are qualified and highly trained, and these assessors will assess the response against an established marking guide. Now, during the marking session, problematic, like sometimes certain candidates, they write the complete sentence in the part A. They may not write the particularly correct, the exact words, what is required. They may not write that. They may write a synonym of that word, or they may write a complete sentence. In those scenarios, the marking sessions will be done by a group of senior assessors for guidance, and all papers are double marked to ensure fairness and consistency. So even if you write a word or a synonym of a word, but the meaning is the same, or else if you do a spelling mistake, and if they are not so sure whether to grant a particular score for this or grant a point for this, they would take a group of assessors, or it will be double checked to confirm your marking is fair and consistent. Okay, now how is the listening test scored? Like I told you before, part A are double marked by trained OET assessors. Now these answers are randomly assigned to assessors to avoid any conflict or interest. So it is given to different assessors, so there will be no partiality. Your answers, if you have written, if the meaning is same as compared to the answer sheet, then you would definitely get it. Your answers for B and C are computer scanned and automatically scored. Okay, so that is because you just have to shade in the right answer, that is computer screen. There'll be no errors in that. But in part A, if you have a spelling mistake, or if you have written a synonym for an answer, then they will cross check and fairly you will get the mark. Now, listening part B. Now let's understand this very clear. Listening part B consists of 6 short recordings that will be played to you. Now, before you hear each audio, you will have 15 seconds to read both the question and possible answers. Now, in reading, I told you yesterday, you listen, you read the question, then directly the text. But in listening, it's better you understand what the options are as well, so that when you are particularly listening the audio, you will be able to eliminate the option which is not been discussed. That is the best way you can do it for listening part B. That is called as narrowing the options. If you're able to narrow the options, like for example, if there are 3 options, normally in part B for each audio, they'll give you 3 options. And if 3 options are given, and while listening the audio, you feel like one option is not at all mentioned, not at all discussed. So in this live listening, what we'll be doing now, we'll be trying to find out which one is not at all mentioned. So you can eliminate that, then you're left with only 2 options. And out of that 2 options, you have to find the closest option. Okay, understand that sometimes it may be very near, but you have to find the closest information. Now, the sentence contains useful information, whichever you would be reading in the question, as well as the context, as well as the scenario which has been described to you over here. You will get to know what is the speaker's profession. That's an important information you should always keep in your mind. What is your speaker's profession? Who will be the speaker's audience? Like normally you will get to hear something, a senior is briefing his colleague, a nurse is talking to a patient, a relative trying to find the condition of the patient. These kind of audios you would be listening. So the scenario should be very clear to you. Okay, so you should be able to understand who is the speaker, what is his profession, and who is his audience, whether it's a colleague, a patient, or who is it. Now spend the rest of your allocated time reading the question carefully and noticing the important difference between the three options. You need to understand, you read the question very well, you can even predict answers. Reading the questions very well, understanding the questions very well, later when you look at the options, you will really be able to predict the answers, what can be an appropriate answer or what is your guess. Keep that guess with you. But once you listen to the audio, then you can choose which is the right option. Okay, next one, the introduction. Okay, so what you would get in listening part B, there will be short workplace extracts about 1 minute each. Okay, now this part B assesses your ability to identify the detail, gist, or opinion or purpose of short extracts from the healthcare workplace. You will listen to 6 recorded extracts, 6 different recorded extracts, which can be a team briefings, it can be a handover, or a health professional patient dialogue, nurse and a patient dialogue. You'll be listening to that, and you need to, from that dialogue, from that communication, from that conversation, you need to find which is the closest option for your given question. Okay, for each extract you will be answering one multiple choice question. Okay, each question will have 3 options. Now when you begin your test, the beginning, the introduction of the text, you will listen this audio. You can just have a check. This audio will be played.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen.
Okay, so this will be the introduction part. In this part, you can definitely use this time to look at the question, the next question which is coming, and you can make sure you will use the technique called as narrowing the options. Now, when you're doing the listening test, narrowing options will be the best method to do, which will help you to reach the right answer. Now, this is also called as the process of elimination. It is like eliminating the wrong options. As you're listening to the recordings, you can cross out any information from the answers options that is not getting mentioned. By doing this, you will help yourself identify which is the best answer. Now, by applying a process of elimination to the listening phase of the recording, you can give yourself a better chance of choosing the right answer. That's what I told you. Like when you're listening, you eliminate one option, you're left with 2 options. Then out of the 2 options, you need to carefully understand what can be the right answer. So for this, the best method is don't just focus on the options. Understand what the options are. When you're listening the audio, you can make small notes, what they are speaking about. When you're able to recollect those informations, you will be able to find out which is the right option. Now we will do it live, and then I'll show you how can you make small notes over here. How can you keep points in your mind and then come to a conclusion, which can be the closest option. I can play the audio again if you did not get it. You just need to comment on the comment box, like if you want a particular audio to be played again, if you have some doubt in that, or some communication, or some sentences you did not get it, I'll help you to find it. Okay, so you can comment the answers in the live chat box, and then later we can compare whether that is the correct answer, and if you have commented the wrong answer, then why that is not a correct answer. This we can find it. Okay, any questions you have before we go into? Now we'll be doing 6 live questions. Out of that, 5 I will be doing it together with you. I'll be explaining. The 6th one I'll give it to do it by yourself. I'll play the audio, you will find the right answer. So anyone has any doubt before we move ahead, you can ask me in the comment box, and then I'll start with the audio, and then we can have a discussion. If anyone who cannot listen to the audio properly, or any trouble, any technical trouble you feel, you can definitely message me in the comment box, in the live chat box. I will reply to you. I'll just hold for 30 seconds and then I'll begin with the audio. Before that, if you have any doubt, you can comment in the comment box. Okay, let's begin. Okay, let's begin. I'll just play the audio first. You will have enough time to look at the question. First, look at the question. Over here, you see you hear a consultant talking to a woman whose father has just been admitted to the hospital. Okay, so here the scenario is a consultant is talking to a woman whose father is admitted to the hospital. Scenario, be very clear with it. The person who would be speaking is a relative of a patient, and the person who would be listening is a consultant. Okay, a consultant will be talking to a woman. So here the main person who would be speaking is a consultant, and the other end, the audience end, would be a woman whose father has been admitted to the hospital. So here the main conversation will be done by the doctor, and the audience, who is a woman who will be listening what the communication is all about, then they would decide what is the condition. Now the question says, what does she want to know about his condition? Okay, so here you should keep in your mind that the keyword over here is know and condition. What this person wants to know about his condition. So you should be very keen enough to listen, understand what she wants to know. What is the question that comes from this woman, and for which the doctor answers. So whatever question this woman would be asking, you should be very careful to it and listen to it carefully and try to write notes. This method you tried, I can assure you it will definitely work with you. Take a pen, take a paper, and when you're listening to the audio, try to write small notes what the communication is all about. At the end, anyways, they give you 5 seconds to shade out the right answer. Okay, you can shade in the right answer. The last 5 seconds, look at the communication, look at the notes what you have taken, then decide which is the right option. I'll also guide you what is the right. I'll also write the points when you're listening to the audio so that I can share it with you and then I can discuss that with you. Okay, now I'll start up the audio, and then I'll give you the appropriate time to look at the question and looking at the options. And then when you're listening to it, if you find any option which is not at all mentioned, you can cross that particular option so that you will eliminate that option, and then you're left with two options, and then choose the most appropriate option. Okay, now I'll play the audio. Here we go.
Now look at question 25. You hear a consultant talking to a woman whose father has just been admitted to hospital. Now read the question.
Now use this time to read the question.
So we've talked about the various things that might have caused your father to collapse. A lot of times we investigate multiple symptoms so as to rule out any life-threatening conditions.
So it could take some time to get to the bottom of the problem.
Possibly. In the meantime, he's quite stable now, and we're encouraged by the progress that he's making.
Well, I'm glad to hear that. But at least he's not in any great discomfort, is he?
According to the assessment at the bedside by his nurse, his pain is well controlled, and we'll try to keep his sedation at an adequate level until we're ready to begin treatment.
Okay, perfect. That audio has been played. Any guesses what can be the right answer over here? You can comment in the live chat box after listening to the audio. If you want the audio to be heard once again, we can do this, since this is not your live examination. If you want the audio to be played again, we can do that. Otherwise, if you know what the right answers are, you can also comment in the live chat box. If you got it, what's the right answer? Okay. Now in this communication, in terms of your notes, what you might have made, you might have heard that they were talking about various things. Like initially the doctor told there are various things which we tried to find out, which might have caused this trouble. We tried to eliminate the life-threatening, or we tried to rule out the life-threatening situations. Then the woman who was talking to the consultant, she told like, so it will take some time to reach the bottom of the problem. Now many people who listen to this bottom of the problem, they may think the answer can be how long before there will be a diagnosis. The diagnosis, the condition, they have already ruled out all life-threatening situations. There are the doctor also said there are multiple reasons for this condition. Okay, that is clearly said. So this is a contradicting statement which says how long before there will be a diagnosis. So there is no relevance that this can be the right option, because in this part, many people say C is the right option. C is not the right option, people. Please understand, I can see Neetu, Ramya, Lassi, everyone commented part C. Sorry, option C. Why? Have you heard the complete communication? Okay, I'll play it once again, then I'll discuss it again with you. I'll play it once again. Give a try once again. I'll tell you C is not the right option. Think again. Listen carefully what the communication is. She is not asking for the diagnosis. The doctor clearly says in the first statement there are multiple reasons for this condition, and we have ruled out various possibilities. We have ruled out all the life-threatening situations. So they have eliminated all those things. Okay, then the patient's relative says, okay, is there anything which is causing a discomfort? Now, what discomfort? We are not able to get it, but later the doctor says, well, his pain is completely in control. We are controlling the sedation rate and everything is in control. I'll play the audio again, listen to it again, then you can give a try.
Now look at question 25.
Carefully listen, make notes.
You hear a consultant talking to a woman whose father has just been admitted to hospital. Now read the question.
Read the question carefully. She wants to know about his condition. She don't want to know the diagnosis. So I have eliminated one option for you. Now we have got only two. Think.
So we've talked about the various things that might have caused your father to collapse. A lot of times we investigate multiple symptoms so as to rule out any life-threatening conditions.
So it could take some time to get to the bottom of the problem.
Possibly. In the meantime, he's quite stable now, and we're encouraged by the progress that he's making.
Well, I'm glad to hear that. But at least he's not in any great discomfort, is he?
According to the assessment at the bedside by his nurse, his pain is well controlled, and we'll try to keep his sedation at an adequate level until we're ready to begin treatment.
Perfect. Now understand this. Understand one more thing when you're listening to this communication. This is a question. This is not an incomplete sentence. This is a question. What does she want to know? So there was only one question she asked. Is he in any great discomfort? Is he in any discomfort? The consultant initially said, okay, fine. So we have talked about various possibilities for this particular thing. Later, we have ruled out many life-threatening situations. So then the relative said, okay, fine. So this will take some time to reach the bottom of the problem. Then the consultant said, it is completely stable. The patient is currently stable. Then there was only one question this lady asked, is there any discomfort, which was about the pain. So the right option is B, how much pain it is causing. Ajay George, you have commented A. This is an option which they did not even mention about how serious it is. So this is the eliminated option. The only two options are B and C, wherein the C cannot be the option because the doctor clearly says we have ruled out all the life-threatening situation and patient is stable. And there were no question from the woman regarding the diagnosis. She just said, okay, it will take some time, right? That was not a question. The only question she asked over here was how much pain it is causing. Understood? I believe now the answer is much clear. I'm trying to break things into much simpler way so that you understand well. Now I'll go to the second question. Over here also you will do the same thing, but please make sure people make notes. Take a pen and paper. When you're listening to the audio, make notes. This is not your live exams. You can have trial. You can try reading all the three options and then listening to the audio works for you, or only listening to the question and audio and then later coming to the options. Some people who are very good with listening, they can try this as well. Read the question very carefully. Don't look at the options. Let the listening audio has been played. Once you listen to the entire audio, look at the option, choose the right answers. Many people get the right answer if your listening skill is good. Okay, I clearly say that if your listening skill is good, this can work for you. Now let's move on to the next one. 26th question. Okay, now over here, you hear a trainee nurse receiving feedback from a tutor about the ward round she just completed. Carefully listen to it. Okay, uh, the accent would be different. It may not be a plain accent, it would be a heavy accent. So you should be able to understand what the communication is all about. What would have improved the nurse's performance? So it is talking about a performance. You hear a trainee nurse receiving feedback from a tutor. So a tutor, who's the first person who will be giving a feedback to this nurse, wherein this nurse would be responding to the question which has been asked from this tutor. So what was our experience? How was the experience? That is something what we are going to listen. Please understand. See, now when you see words such as this, eliciting, if you're not sure what word it is, what is the meaning, you need to make sure you underline these words, try to find the meaning for these words. Now, to learn a new vocabulary, just writing it down and by hearting it later won't help you. Make sure whichever word you learn, first step is find a meaning for that word. After finding a meaning, make 2 to 3 sentences using that word. You will never forget that word after that. Eliciting means obtaining or taking information, eliciting information from the patient, obtaining information from the patient. Second option is keeping the patient better informed, updating patient notes more fully. Updating patient notes more fully. Now, there'll be one option which is contradicting, which means the opposite thing you would hear in the lesson. There'll be one option, they did not mention anything about it. There'll be one option which is the closest and the correct option. So I'll play the audio. Pay attention, be attentive, make sure you take down notes when you're listening to the audio, then choose the right option. I'm trying to make it as simple as possible. Here I go. I play the audio.
Question 26. You hear a trainee nurse receiving feedback from her tutor about the ward round she's just completed. Now read the question.
Read the question carefully and read the options. Yes, Neetu, you're correct. Collecting or gathering or obtaining, that is the right information. Right word for eliciting.
How do you feel your ward round went with that patient?
Oh, I really should have told him what I was about to do rather than just rolling up his sleeve to take his blood pressure.
Yeah, it would have been preferable, but at least you realise.
Thanks.
I think you did your observations really well, though. You checked the patient's details are correct, you put the date in, you timed it correctly, you observed that all your parameters are within normal range, and you did the respiratory rate while you were doing your manual pulse.
Yes, the pulse was quite strong and regular.
And you could have passed that on to reassure the patient too.
Oh.
But you look back at the previous observations, put your signature at the bottom. That's all good.
Thanks, okay.
Perfect. So what can be the answer? People, come up with the answer. What can be the answer for this? What could have improved the nurse's performance? And over here, you might have heard in the beginning, the nurse said, I should have told him that what I'm about to do. Observation, she did very well. Before taking the blood pressure, she just rolled over his sleeves and directly, without informing him, started taking the blood pressure. Then you might have heard the tutor says, okay, you have recorded everything so well. Even you went ahead and recorded the pulse while you were monitoring the blood pressure. You also counted the pulse, the breathing, everything was done very well. But at the end, the tutor also says, you could have passed this information to reassure the patient. She said, yeah, I would have done that. She has not done that, right? So over here, the contradicting information, what we find is the C option says, updating patient notes more fully. The tutor did not say you would have done something more better. You could have added some more information into the report, wherein the tutor said, you have done things very well. You have recorded all parameters very well. But the only thing what you could have done is you could have passed on this information to the patient as well, so that he might have been reassured, right? So the closest option. Now, the option which is eliminated over here is eliciting information from the patient. Eliciting information from the patient is not something which would have improved the nurse's performance. Eliciting is taking information, collecting, gathering. You guys have given me a lot of synonyms for that: collecting, gathering, obtaining. So Taking information from the patient is something which they have not talked about. Rather, they have spoken about keeping the patient better informed. So over here, most of the people, yes, you have given the right answer. That is B. Ajay George, the C is not the right option. I think I've explained you very well why it is not, because it is not speaking about updating patient notes more fully. Okay, the tutor clearly said you have done it very well, all the parameters you recorded, but you could have passed this information. You should have passed this information to the patient for his reassurance. Wonderful people, you're participating it very well. Let's move on to the other question, that is 27th. Now over here, you hear a hospital nurse briefing a colleague. Here the main speaker would be a hospital nurse who is briefing her colleague about a patient with a chronic obstructive pulmonary disease or COPD. What does he want his colleague to do? Listen to it carefully, make notes, encourage greater mobility. Is it something what they're looking for? Organize a visit by a dietitian, consult with the medical team. These are the three options given. So I'm giving you an explanation over there in the examination. You should utilize your first 15 seconds, quickly go through it, understand it, and then be ready for it. Now I'll play the audio, then we can check.
Question 27. You hear a hospital nurse briefing a colleague about a patient with chronic obstructive pulmonary disease, or COPD. Now read the question.
Quick, you have only 15 seconds.
So who's next?
The patient in bed 12, she had a fall at home about a month ago, but she's otherwise independent with her day-to-day activities. Her falls risk is high given her recent history. She's been assessed by the physio and she's on a rollator frame to ambulate. Her skin integrity is intact and she's responded well to all treatment.
Good.
She's on a normal diet. The observations were last done at 6 a.m. and they were stable. Her medications are IV tazocin due at 2 p.m. and prednisone next due at 8 a.m. tomorrow.
Okay.
You need to check with the doctors today whether she'll continue with the IV antibiotics and whether the cannula can be removed. At this stage, they're aiming for discharge in a couple of days' time, pending discharge from the physio and also ceasing IV antibiotics.
Okay, thanks.
Okay, perfect. I think it was pretty easy and direct. Okay, now what can be the option? So you heard that the patient who was there in bed number 12, she had a fall at home. Fall risk is really high. She's ambulating well using a frame. She's assessed by the physiology department. Observation was done at 6 a.m. She need to check with the doctor about the antibiotics and IV line, aiming for discharge, and there are some pending discharge plans. So what's your option over here? What do you think the right option would be in this? Now, many people say is organizing. Okay, can you come up with your options? What is your options? Okay, very good. Everyone says C, consult with the medical team. Neetu Binoy, she says C. Ajay George says C. Tessie Jacob says C. Wonderful people. Okay, so it was pretty easy. The answer was very clear. She need to consult with the doctor. She need to consult with the physiology department. The pending discharge from physiology, it clearly says there is a pending discharge from physiology and a ceasing antibiotic. Ceasing antibiotic means stopping or discontinuing. Cease means discontinue. So discontinuing antibiotic is something which is pending from the physiology department. Ceasing antibiotic something pending, and there is a pending discharge plan from physiology department. She need to check with the doctor about the removal of IV line and ceasing of antibiotics. She need to confirm with physiology. She need to confirm about ceasing antibiotic as well. So there are many things which she has to do, consulting a variety of medical team. So that's why the correct option over here is consult with the medical team. Wonderful people, you have done very good. The right option over here is C. Beautiful. Even Lissy Korean says C. Perfect. Lissy, Neetu, Ajit, Tessie, Jingle, and Christina. Perfect. C answer is the correct option. Let's go to the next one. That is 29. You hear two hospital managers talking about a training session for people who do voluntary work with patients. What do the managers think about the course? Okay. Now you hear two hospital managers. This is going to be a complex one. You will have to listen carefully. It's about two hospital managers who are discussing about a training session, okay, for people who do voluntary work with patients. What do the managers think about the course? Too few people which means very less people attended to make it worthwhile. The content may need revising for future session. The feedback form participant was not encouraging. The feedback form was not encouraging at all. Now I'll play the audio, pay attention, and then we begin.
Question 28. You hear two hospital managers talking about a training session for people who do voluntary work with patients. Now read the question.
So how do you think the volunteer training course went?
Well, we had a reasonable turnout, considering that these people already give up their free time to drive patients to appointments, visit inpatients, all sorts of stuff like that. It's quite a lot to ask. It's a wonder so many managed to fit in the training too.
And they did seem to get something out of it, if the feedback sheets are anything to go by. From my point of view, though, I just wasn't sure whether it went into issues like customer care, confidentiality, that kind of thing, you know, in enough depth.
Well, that's something we can always look into before we roll out any more.
Well, I think we should.
Perfect. Tell me the answers. I know it was a little complex, but if you got the answers, nothing like it, people. Now, it was clearly saying that there were a reasonable turnout. Now, many people, if you did not understand what you mean by turnout, you need to find that. Okay. Now, I'll tell you in this point, reasonable turnout means attendees. Reasonable attendees were there. Turnout means people turning out into the seminar. They were reasonable, which means appropriate amount of people came into the seminar. Now, already I've got an answer. Neetu Binoy says D. Okay, next. Then the team manager said that considering they have already give up their time to drive patients into the hospital for free consultation, visiting patient, which means even though they have sacrificed their time, even though they don't have time, since they have to divert their time for driving patient for free consultation, visiting patient, it is very difficult to bring them in. But the other manager said, I also saw some issues such as confidentiality, customer care, and kind of thing, and in and out death report were not added in the training program. Then the other manager said that we can consider before we roll out more, which means before we do the other sessions, the future sessions, we can consider about that. Maximum people, Neetu Aji, Jingle, Bindu Aji, and Christina George, you all says B, that is the correct option. Too few people attended to make it worthwhile. This is a contradicting statement because she said there was a reasonable there were reasonable turnout. The C option says the feedback from participant was not encouraging. They were talking about the feedback, but the other lady, the other manager did not speak anything about feedback. She did not give a reply about that. Rather, she moved on to another topic. That's why this is an option. C option is the option which we can eliminate. It doesn't have any relevance. Hence, the correct option is B. So you got it, the correct answer. The content may need revising for future options. Second last one, question number 29. You hear a pharmacist talking to a doctor about a patient's medication. What is the pharmacist doing? Report, you need to listen to it carefully. Pharmacist is talking to a doctor. He's not taking an advice. Understand this. He's talking to a doctor about the patient's medication. So here the main speaker is pharmacist. Don't consider doctor as the main speaker over here. Pharmacist is the main speaker. So this scenario description is always important. You should pay attention. Don't ignore this. You hear a pharmacist talking to a doctor. What is the pharmacist doing? Reporting side effects, checking the dosage, recommending an alternative. Okay, now listen to it carefully. I play the audio now.
Question 29. You hear a pharmacist talking to a doctor about a patient's medication. Now read the question.
Sorry to bother you, Dr. Baker.
I just wanted a quick word about Mrs. Milton's prescription, the one for anti-inflammatories that you gave her after last week's consultation.
Oh, yes, for her osteoarthritis.
Yes, so she's been on them for a week now, 500 milligrams twice daily. The thing is, she's just been into the pharmacy complaining of a headache ever since she started the medication.
Really? Well, that does happen in some patients, but maybe switching her onto a different anti-inflammatory wouldn't be a bad idea.
Okay, I'll look into some options and then run them past you later, shall I?
Fine, thanks.
Okay, so what is the right option over here? I think it was clear, right? It was pretty clear, wherein they were talking about a patient called Mrs. Milton. She was prescribed with anti-inflammatory a week ago for osteoarthritis, 500 mg twice daily. Patient was complaining of headaches since she started. This is what the pharmacist reported, that she's complaining of headaches since she started. Now, then the doctor said that, okay, fine, we can think of switching her into a different anti-inflammatories. The pharmacist said, okay, I'll look into some options and I'll get back to you and I'll pass it on to you later. Okay, that is what the exact word, and I'll pass it to you later. Okay, so what can be the right option over here? So I've already got answers coming in. Neetu Binoy says A, George says A, Stacey Jacob says A. Perfect. See, now understand over here, even others, Bindu Aji, Lissy Korean, everyone, wonderful job. Now, over here, B option, checking the dosage. He was not checking the dosage. So this was an option which you can remove. There is no problem. You can remove this option completely. This is an eliminated option. The only two options which is more closer is recommending an alternative and reporting side effects. Now, recommending an alternative will be not the right option because he is really not recommending any option. What he's doing right now over here is he's just saying that I'll look into some alternatives and I'll report to you later. So he's not recommending an alternative. He will find an alternative and later he will discuss it with the doctor. So the closest option over here is reporting side effects. So right answer, all of you, 100% right answers. I'm really happy that you're able to get the right answer. That's perfect. Now let's move on to the last one. That is the 30th question. I'll play the audio. Here I'll not give you any explanation. You'll have to go through it by your own. I'll just play the audio and just give me the right answer. At the end, I'll just give you an explanation for this. Here we go. We start. Daniel, I can see that you've given the answer A, which is the correct option for the 29th question. Now I'm moving on to the 30th question. Let's play it.
Question 30. You hear a surgeon talking to a member of his team as they are finishing a surgical procedure. Now read the question. Good, there's no more bleeding. The procedure's finished.
Can we just do the sign out? How much contrast did we use?
That was 120 mils of Omnipaque, and we did reach a high dose, so I'll have to fill out a high dose form. I'll do that afterwards. The other thing was that the ultrasound machine was giving us a few problems.
Yeah, I'll have to get the technician on the phone.
Do it now, though, because we'll need it if we're going to get through all our lists today.
Do we need to send this patient up to HDU?
Actually, everything was quite straightforward, so I'd say a regular ward bed is fine.
Perfect. What can be the right option? Tell me over here. I need answers from you. What can be the right option? The surgeon says the next priority should be. So here your keyword is priority. What's the biggest priority, what he feels need to be done right now? Did you listen anything as such? What can be the right option for this? If you have found your right answer, just type in your right answer and send it to me. The first option says to complete a routine administrative task, to report a faulty piece of equipment, and the C option is to locate an appropriate bed. Okay, now over here, it clearly says, first thing when they started, okay, let's do a regular sign out. Let's do the sign out. They did not say anything about the routine administrative. It is not an administrative task at all. So the option which we can remove it over here is A, to complete a routine administrative task. They were not completing any routine administrative task. It was not an administrative task. The nurse says, oh, let's do the sign out, the dosage, the high dose of sedation they have used peaked 120 mLs. So the doctor needs to fill a high dose, but he said, I'll fill the high dose form later or I'll do it afterwards. There were few problems USG machine were displaying during the surgery. The nurse said, for which, okay, I'll look for a technician and I'll call him. Doctor said, do it right now, because we would require it if we are going to get through our list today. So that means do it right now. If we are going through our list of surgeries, which is scheduled today, we need this machine to be fixed. Okay, that was a priority. Then at the end, she says, do we need a bed at HDU? Many people get confused over here when they hear the word bed. When they hear the word bed, they automatically think the right answer is C. She says, do we need a bed at HDU as things are normal? Then the doctor says everything have been well, so ward bed would be fine. So when they listen to it, most of the people do choose C, but I'm really happy with you people. You have chosen B. The right option over here, the priority, which he says do it right now, is to report a faulty piece of equipment, which was the ultrasonography machine. Wonderful people, wonderful participation you have done. I believe I have made it pretty simple for you to understand listening part B option. I'll also come up with more challenging lessons tomorrow or day after tomorrow. I'm planning to come up with a challenging writing question, which will have various multiple dates in the background. It is very difficult for many candidates to understand when they see a list of dates, I would say 10, 13, 14 dates together in the background, which information you should take. Many people are confused with this. So I'm planning to come up with such lessons. If you have attended this, please make sure share this YouTube video with your friends on WhatsApp or on other mediums. Please share it. Also share it with your friends as well. Okay. We also train candidates for individual writing, wherein the assessments are given one-to-one. We take module by module lessons as well. Also, we have a complete integrated training lesson. So if you need any further contact, you can subscribe our channel on Facebook, or you can subscribe this channel, YouTube channel, so that when we come up with more lessons, you will be notified and you can take benefit of it. Please make sure if we are doing this, make sure you share it with your friends so that even they are benefited. Okay, you can also come to our Facebook page where we post CBT questions. We also provide CBT trainings. We provide trainings for IELTS. We provide trainings for OET, CBT, and OSCE. That is what our expertise goes into. So if you need any help, you can contact us. My number would be there in the comment section, in the description section. My number would be there, or you can contact us through the Facebook page. Thank you so much for joining in, people. Have a beautiful day ahead. I believe I tried my level best, and my explanation have really make sure that you are clear, and in future when you're doing listening part B, you'll be able to do it much better way. Okay, thank you so much for joining in. Have a great day. Bye, people.